Many people across the country will be struggling with their mental health, with lockdown meaning separation from loved ones and potential anxiety about returning to work. We can speak now to Paul Farmer, the Chief Executive of the mental health charity Mind. Very good to see you this morning, Mr Farmer. How bad is it getting? Do we have any idea of the effect that COVID-19 and indeed the lockdown is having on the nation's mental health?
Yes, well, we are concerned about an emerging mental health crisis. And in particular, there are three groups that we are paying particular attention to. First of all, people with existing mental health problems, where we know from our own surveys that roughly 2/3 of people with existing mental health problems are reporting their mental health is deteriorating. Secondly, we're concerned about those people at greatest risk as a result of the COVID crisis, frontline workers, people from Black and minority ethnic communities, people maybe living in abusive households, and we know their mental health is at risk as well. And then finally, of course, as a wider public, we know that we've all been asked to do things that are, broadly speaking, not that good for our mental health, being separated from our loved ones, some of those protective factors that we put in place to sustain our mental health being removed. So we do have these three areas of concern, which I think all add up to a very significant issue for our country's mental health.
Um, as many people have perhaps taken you as alluding to, there has been a focus on people's mental health suffering through this process. But as you mentioned, perhaps as many as 1 in 4 of us had a pre-existing mental health condition before COVID-19 came along. What has been the effect on the access to mental health care provision?
Well, I think the positive from the last few years is that more people have been more aware of their own mental health and have sought information and support. Roughly 1 million people downloading information from our website in the last few weeks alone, just to think about how they look after their mental health. But we do seem to be in this slight paradoxical situation where many people are reporting deteriorating mental health, but the NHS is reporting a decline in numbers of referrals into the mental health system. So we do think it's incredibly important to stress that mental health services are very much open for people to approach them. There is currently the capacity in there. But we are also in the middle of rebuilding mental health services from a position where really there was far too little investment over a very long period of time into building services as a fit for all of us, our whole population. And we're still on a journey towards that. So we think that services are going to come under considerable pressure over the next few months. And it's absolutely vital that appropriate action is taken now to put in place the resources and the support that's needed to cope with what's likely to be quite a significant mental health surge over the course of the next few months.
We've been discussing on the show this morning the idea that many children may be going back to school on the 1st of June. And the lack of contact that young people are being having with their peers, their social groups and all the rest of it is bound to be having an effect. In your mind, would it be better for children to be back in schools sooner rather than later because of that mental health aspect?
Well, that's a decision for government and local authorities to make about on the grounds of safety. But from a mental health point of view, we know that young people are missing their friends, they're missing the peer contact that they have. Fortunately, many are able to keep up with their friends through social media routes. But I think the quicker we can get young people back into their kind of normal cycle of activity, the better that will be for their mental health. Looking after with support from parents and teachers and professionals. And I think we're particularly wanting to make sure that young people who do have mental health problems are able to access that help and support as quickly as possible, and that really effective referral routes are put in place to make sure that people can reach the mental health support they need. Let's not forget that the number of young people with mental health problems was already on the rise before the COVID crisis, increasing from roughly 1 in 10 young people to now 1 in 8 young people. So there's a real need to make sure that we are highlighting the importance of young people who may be developing mental health problems getting access to that help. And if it's not possible to do that through schools, then other mechanisms need to be found to make sure those referrals are able to take place so that young people get the help they need particularly. And I think we're particularly concerned about young people with emerging eating disorders and we've heard increasing levels of anxiety and indeed loneliness amongst young people.
Well, many of us, myself included, have had our wobbles and our struggles. If people want more information, they can head straight to Mind's website. But for now, Paul Farmer, Chief Executive of the mental health charity Mind, thank you so much for joining us.